Hi, everybody, and wonderful to see you on this Friday, July 24th, 2020. Welcome to COVID Conversation Series. This is a Ready for Black Lives initiative. For those of you who are newer to joining us, Ready for Black Lives stands for Research, Evaluation, Data Collection, Ethics, Protocol for Black Populations. You'll be hearing more about that throughout the session, and we'll have some announcements at the end. We are live streaming from Toronto, Ontario, Canada. My name is LLana James. Thank you for joining us for today's session titled Public Health, Ethics, and COVID-19, How the Next Generation of Scholars and Organizers See the Current Moment. We begin, as we always do, with a land acknowledgement, followed by a moment of silence. Then I will provide a brief overview of today's session, and now we go to the land acknowledgement. I'd like you to sit as comfortably or lay as comfortably as you can. And I would like you to take a few deep breaths. And now we begin. Close your eyes if you are able. We'd like to start by acknowledging the land on which we are gathered today, and by acknowledging the caretakers of this land. This land is the treaty territory of the Mississauga of the Credit First Nation and the ancestral and traditional lands of the Anishinaabe, Haudenosaunee, Ojibwe, Chippewa, and Huron-Wendat nations. Listening and reciting land acknowledgements is an important action. However, ending settler colonialism, its discriminatory institutions, vehicles of knowledge production, and white supremacy that it thrives on is equally as important. I ask you, what are you doing to end the occupation? The moment that we're in demands more than an acknowledgement of Canada's settler colonial past and present. It requires you to do something different. I invite you to do that as you participate with us today in the COVID conversations. Please open your eyes and take 3 deep breaths with me. And now we move into our moment of silence. Today, here in Toronto, we stand in resistance to police violence and state sponsored violence. We also stand in solidarity with our African American brothers and sisters in the US and everyone around the world. We know that 2020, like so many other times before this, is a time in which we must resist those things that make us smaller, shrink away from our human rights and from democratic processes. So, in this moment, I ask you to be in a moment of silence, respecting and standing with those who have been and lost their lives in the presence of police as a result of their choices, the choices of police, that is. I ask you to stand in solidarity with those who are resisting dictatorship like regimes, both here in North America, in our provinces, our cities, and our states. And I ask you to stand in solidarity with people around the world who are struggling for their human rights to maintain democratic and electoral processes where they're informed and can meaningfully participate without fear or threat of violence. So, in this moment, we recognize the death of so many, and especially recently in the Toronto area. We've had more people pass away as a result of the police being present, innocent people who lost their lives. And so, in respect for their families and ours, I ask you to close your eyes and take 3 deep breaths as we recognize all that is before us. And now I will revisit the session description and introduce Nishan and Ciann, who are here with us today to have a conversation. We're then going to jump directly into that conversation. I encourage you to use the chat and put your question in as you see fit. And we will bring up as many of those as is possible in the time we have today. And I just want to point out our format is a little different than the session on Wednesday and Thursday, in that this one, you're actually going to be having a conversation with us. So grab your coffee or your tea or your water, pull it up close to the computer, and join us as we go into the discussion of public health, ethics, and COVID-19, and how the next generation of scholars and organizers see the current moment. Nishan, Ciann and I will explore the intersection of public health, race-based data, privacy, and big tech within the local and national contexts. We will reflect on the ethical questions that Cathy O'Neill and Jack Poulson brought into view on Wednesday and Thursday, with a focus on data sharing during and post COVID-19. Recent changes to Ontario Regulation 569 and the Freedom of Information and Protection of Privacy Act and the Personal Health Information Act will be explored as a case study. This dynamic and interactive conversation from the next generation of scholars and organizers will examine how data and who controls it affects people, neighborhoods, and health. I'll now introduce Nishan Zewge-Abubaker, who is one of the co-founders of the Black Public Health Collective, which is a collective of critical Black public health researchers and practitioners committed to better conditions for Black life. Born and raised in Toronto, Nishan has organized for many years with young Eritrean and Ethiopian communities and is committed to strengthening deeper networks of care beyond public institutions. Nishan has a Master's of Public Health in Social Behavioral Health Sciences from the University of Toronto, focused on mixed methodologies and evaluation. Nishan's work is primarily concerned with critically examining interventions that attempt to address the spatial distributions of health and Black well-being. Can you just say hi to everyone, Nishan?
Hey, Lana, thanks for having me. Really excited to engage in this conversation, and thanks for inviting us in to speak together.
Wonderful. Now I'm going to introduce Ciann Wilson. Ciann Wilson is an associate professor in community psychology at Wilfrid Laurier University. Ciann is an Afro, Indo, and Euro-Jamaican ancestry. She has over a decade of experience working within Indigenous, African, Caribbean, and Black communities in Canada. First as a youth programmer and now as a researcher and tenured professor, I might add. Congratulations, Dr. Wilson. Ciann is the director for the Access and Equity Research Interest Group and co-director of the Center for Community Research, Learning and Action, CARLA, at the Wilfrid Laurier University. Ciann has a proven track record of work with Indigenous and Black communities, having published pieces such as Narratives of Resistance, retelling the story of HIV/AIDS movement because the lives and legacies of Black, Indigenous, and people of color communities depend on it. Ciann, thank you for joining us.
Thanks for welcoming me back, Lana.
Thank you. And so now today, I just wanted to first of all start off with welcoming everybody who's listening today and who's joined us over Wednesday and Thursday. So on Wednesday, we had Jack Poulson, who shared with us a key report that he did, and as well as his work. And so that report is called Reports of a Silicon Valley Military Divide Have Been Greatly Exaggerated. And so if you're either using the Eventbrite point to enter or the website, you should be able to easily access that link. And so in that report, what Jack Poulson did was he went through and he looked at the relationships between tech companies, both the big six and smaller companies that you, I, and others may not be familiar with, who are deeply in relationship with the Department of Defense. And so that's the US. And it's an important point because many times as folks in Canada, we like to think, la, 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 we can't hear it. We don't have these problems in Canada. We don't have to worry about the militarization that's going on through technology. But unfortunately, those companies and those relationships don't have borders. When they win these very large contracts, these multi-million, almost billion-dollar contracts, what those clients ask for become what we get, whether we asked for it or not. We also inherit those relationships, those violences, and those human rights concerns. And what we found out was not only the big six, but a number of other companies that are in our pockets, because as taxpayers, we're paying these corporations who have human rights violations, who don't do the ethical thing, and who barely follow the rule of law, then get taxpayer dollars to do the same thing to us. And as we can see, we've had a little bit of sleepiness here in Canada, where our privacy commissioner, both at the federal and the provincial level, have almost not acted without the press doing it. And we know the Tour Star has recently been purchased over. We're losing our free press. And so what does it mean when the only way we see real action happening and intervention is when it relies on the press, because we have a very reactive privacy and information commissioner. So many of us are under the illusion that someone is actually looking out for our interests, and that may be true to a very, 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 very small degree, but it's really about us, and that's part of why we're here with you with COVID Conversations, because there's a lot being pushed past us without the ability to look at it. So Jack Poulson highlighted some really key information, and I encourage you to go back and look at that. But one of the couple of the things we want to highlight for you that we're going to talk about is not only that relationship between technology companies and the military, but also how that impinges on our ability to make choices that are truly in line with our own constitution and our own human rights, because these companies have a very extensive track record of not respecting any of those in Canada, in France, in the EU. And it also raises the question why so many of them are here procuring their goods, given that many of them are not able to function wantonly as they are in Canada, as they are in the EU, because they do have a set of data laws and regulations that are quite superior. They don't, reach as far as they need to because they were watered down by big business, but they do a lot of work that we don't have done here. So Jack talked about also the ethical concerns, right? That a number of these companies are not only developing war technology, they're using our labor to and develop that war technology, but that war technology is also being turned back on us here in North America. The same devices that they're using to hunt down people are being used to hunt us down. And the question is who? And it's the people that often are let's just say, not always taken up in the bosom of Canada. So Black, Indigenous folks, working folks are often the target of that. And so we have to be really careful. And we've seen our own jurisdictions literally misrepresent themselves and have to admit to lying. So we saw Clearview, which is a face recognition technology. We've had some pretty respectable scientists, Joshua Benjamin out of Montreal, a lot of silence and crickets over here in Ontario, but at least write back and push back against that facial recognition software, which comes again out of that big tech Department of Defense relationship. So we know that things are showing up here in Canada, and we know that our cities and our provincial leaders are not, in fact, telling us what's going on. And even when investigative reporters go in and find out the news, they're concealing it. So we found that the Toronto Police, we found that other regions in the GTA, as well as Kitchener-Waterloo, are using these technologies, which are actually designed for the field of war. These are used in Afghanistan, right? These are used in the theaters of war where people die. And this is what they've brought to your city with your taxpayer dollars. Now we'll move on to summarizing some of the key points that Cathy made. And Cathy's talk was extremely relevant because she brought in, again, bringing another layer in. When you put that together with what Jack said, Cathy pointed out that there's 4 key themes, and we'll bring them up. And those themes are about the realities of how, in fact, algorithms are simply, as she says, quote, opinions in code. So for those of you who have not read Weapons of Mass Destruction, it is a seminal text. It was released in 2016 and continues to make reverberations and is well respected in the field, as is Dr. O'Neill. And so when she spoke about the concerns around how technology, and particularly algorithms and their opinions embedded in code, continue to push disparity and exclusion, she pointed out 4 themes, which were the propagation of inequality. This is what algorithms do for you. They do that also through the missingness of data. And we're not talking about adding more data. We're talking about the structural ways in which we use technology's data field to construct a reality that is a proxy, and how that proxy fails miserably. 3, anonymization. And that is really tied to an asymmetrical power, meaning that there are people with a lot of power, like the police, the state, education, children's services, your boss, and how anonymizing or de-identifying your data is actually a red herring. And anybody who's telling you that you're going to be protected because data is anonymized, please listen to yesterday because Cathy breaks it down explicitly and effectively. And number 4, she talked about outsourcing accountability, and that includes outsourcing ethics. And she spoke about that because algorithms are in fact just opinion and code. And we know because Canada is a settler colonial nation that is saturated not only in anti-Black racism and anti-Indigeneity, but in white supremacy. And those aren't my opinions. Those are actually well documented in a 2017 report by the United Nations on their visit to Canada when they described how egregious the racism is within and, as they said, quote, in all institutions. And so Cathy pointed out how so often algorithms are suggested to be neutral, biased, and somehow doing almost magic. That's not so. It's opinion and code, and that's it. So I'm now going to, having recapped those two key talks that we had prior, we're going to kind of speak about those and go forward talking about what's happening here in Ontario. And one, we're using Ontario as a case study so that we can look at this in applied ways, because there's a really false narrative going on right now, especially during COVID. Everybody's trying to tell us that you need to give up your data, you need to give up your privacy because it saves lives. When what we in fact know is the things that would have saved lives in Ontario and many other jurisdictions would have been the provincial governments actually instilling and requiring that labor laws and protections were in place at long-term care facilities. The vast majorities of deaths in Ontario and across Canada, particularly in Ontario, have happened as a result of privatized long-term care, where the rules went out the window and money talked about who ran it, and everybody else, well, unfortunately, some of our elders have been buried as a result of this for-profit fiasco. And so data won't save us, facts. What will save us is using our constitutional rights to make sure that there are protections in place. You could know the race of everybody in this country, but it would have done absolutely nothing in COVID-19 because we knew in H1N1 how deeply Black and Indigenous people were affected. That data was not secret. And the government of Ontario and Canada chose not to use it in any meaningful way. So one of the things we're here to do is dispel the myths that data generates accountability, that data somehow intervenes, because what we need is for people to save their lives and for us to save our own lives by acting effectively. And so I invite Ciann and Nishan, please take off your mutes. Let's jump in and have a conversation. Everybody pull up and please join us in the chat.
I want to jump in actually, because thank you so much for that really great summary of the wonderful conversations that you had with both Paul and Cathy over the last 2 days. Really salient summary of what they were talking about. The one thing I wanted to pick up on was sort of the repackaging of what's being offered to us under altruism. And I think Poulson talked a little bit about this. Jack Poulson talked a little bit about how these companies come to us and repackage these nefarious things that they're doing as altruism. So they're, for example, brokering deals like, oh, we'll give you an entire system and server and set it up for $1 and sell it to our government, not, explaining that all of the data collected, for example, is something that they have free reign over and are able to buy and sell it, and not explaining that they make tons of money from that data either. And so the repackaging of what's happening here and the repurposing of how it's talked about. So yes, this idea that, gathering our data for health is something that's altruistic and we should all have access to this, and really selling this across the country on a national scale. I mean, the Tri-Council started these conversations about 2 years ago, I would say roughly, when they started talking about, having public access to publicly funded data, without any sort of conversation about how problematic that might be in some instances. So for me, what I'm also noticing is this repackaging and repurposing of language to make things that are otherwise nefarious seem like it's good for you, like it's good medicine, right? And you see this with alternative facts. You see this with folks sort of rejigging the language around racism to talk about racism towards white people and white lives mattering, like the whole repurposing and repackaging of language, which I think is really interesting how it extends into this realm as well to basically really confuse folks and create, an alternative fact verse is what I call this, an alternative reality within a reality. And so just really picking up on that particular piece and just wondering, Nishan and Lana, what you thought about, that sort of repackaging, repurposing of language.
Mm-hmm. Yeah, I totally agree. I think it was really interesting bringing the healthcare, like watching this, having worked in a health context, because you could kind of see so many of the parallels coming when you're seeing the expansion into weapons, kind of paralleling this kind of expansion into healthcare, and really how, as Jack Poulson kind of made that comment, like they're actually the same force, but two very different mechanisms. They package very differently, but they're effectively kind of doing a very similar thing and kind of creating this entire empire of surveillance for us and profiting off of that. So I was like really nodding my head when you were talking, Ciann, and kind of bringing that into the healthcare kind of context. And I think another thing that I was really thinking about that really hit me when I was watching that particular talk was that there's this kind of swapping out that happens of we are talking about how unethical we are seeing the moves that are being made, but the response back to that is, okay, well, let's have, from these huge institutions that have shown to not really respond to any actual enforcement, there's not really anything to enforce it to. Let's have these ethics guidelines, and there's so many, right? Lana talks about this a lot. And instead, what was really hammered in is that you don't have that regulatory framework, public institutions are really opening themselves up to being another arm of private interests. And I think one thing that was, there's this article by The Intercept that was shared with me that was talking about the discourse and the conversation around ethical AI, and how that discourse itself was started by a man, was like really led by MIT, who actually had these simultaneous funding from Silicon Valley for his own private ventures, and how that has completely replaced any actual abilities to hold even private corporations accountable, even though these are happening through public institutions. So why are we having to kind of fight that on both fronts? Like, it doesn't really make sense to me. So I think it really becomes concerning because you see those ties when there are the deep collaborations that are happening between the big six tech companies in the US and military and law enforcement, and noticing and knowing that four American private companies own and manage 90% of our electronic medical records data in Canada, right? So those concerns are actually not quite as different as we might think. And it seems to be kind of masking it as a more altruistic force, as you're kind of saying, Ciann.
And I'd like to jump in there. And I think the ethics washing thing is a very important piece because it's almost an act of disinformation. And what's been very curious for me in being closely examining this area and being deeply familiar with it, as it is one of the areas that I research, is that the ethics washing was timed exquisitely. So exquisitely that only probably handfuls of us were like, hold on, why are we talking about ethics? I mean, that's wonderful. As someone who has a really strong grounding in ethics, I think that's a necessary conversation. But the reality is that laws and regulations are what govern a constitutional democracy. And ethics are the questions that need those laws to rub up against. And so I wasn't surprised when that gentleman's ethics washing scandal was busted, and it was tied directly to Jeffrey Epstein. The only reason we found out where that needle was in a haystack was because they were all in the same address book. And when he was getting questioned, there were some things that started to pop up, and that Intercept article is available. We'll either try to pop it in the chat or put it in the references for folks to get access to after this is posted. So it's very curious because there are in excess of 2,800 different ethics statements globally. There's a research lab up in the UK, I believe it's Lethbridge, where the researcher scientist did this amazing job of mapping them all globally. And it was mind-boggling. And to me, it was, to a degree, also very sad, because I'm sure not everybody had the time or the resources to be going down that rabbit hole. And they were falsely led to believe that you can draft ethics statements and principles and they actually do something. And I shared this in a keynote address. I'm able to be here with you all, live streaming. I'm able to be a PhD candidate at the University of Toronto in the Faculty of Medicine with my area of expertise in AI, clinical care, etc., because my ancestors went up against the law. Could you imagine if they sat around supporting ethics conversations? Like, would it have ever ended? And so it's absolutely ludicrous that people are being led down this path that you can just keep developing ethics statements and they do something. So in Ontario, what we found is, and unfortunately the slide won't load right now, but I'll just point out very quickly, we've had several changes in the last 3 months alone to the Personal Health Information Act, right? And significant changes. So we've had, for instance, regulation 329, and it seeks to, quote, to deal with prescribed organizations and elements of unique identification of information exchange. So you have to ask yourself, so what does this mean when we say unique identification of information exchange? So what kind of algorithm is behind that? What kind of data field is behind that? What is it linked to, and who gets to make those decisions? Again, that's just one of several. There's another one that just closed on July 22nd. And of course, when I checked with folks, unless you're a privacy lawyer or you're a law firm that plans to get corporate business, most Ontarians have no idea. And this is not just happening in Ontario. Take a look, Alberta, take a look, Manitoba, take a look, British Columbia, because the same thing is happening to you, especially if your political parties have a leaning towards making sure they can liquidate trillions of dollars of public investment and hand it over to private corporations. And so we look here at the Digital Health Interoperability proposed amendment to Regulation 329 that closed on the 22nd of July, and it's to establish interoperability specifications. Sounds benign. You're like, okay, we're going to modernize it, but there's more to it than that. What Jack talked about and what Cathy talked about is rolled in there. So interoperability means the ability to move data from one location to another unrestricted. Sounds great, right? But what happens when that's your health file moving into the police car, as we've seen in Kitchener-Waterloo, as we've seen in the GTA? So do they really have the right to that data? No. And so we have a question here. What is interoperability going to do? And how is it going to undermine your human rights? How does it undermine the Constitution? And biggest question, where is the privacy commissioner, federally and provincially? We'll be coming back to you with that from COVID Conversations in the upcoming weeks. We've got some lawyers, we're asking some questions, because clearly the government may or may not be interested in us asking those, but we're interested in having the answers because you asked for it and we're going to find it. And again, we now look at Bill 188, another incursion on your personal health information. And that sought to, quote, make it available to extra ministerial data integration units. What's quite curious about poring over this piece of once proposed, now enacted as of March 25th legislation, is that that does not tell you who it is. But if you're in the ecosystem, it's, ladies and gentlemen, a private-public, read bigger with the P in the front than the second one, private-public relationship. So be prepared for a private institution near you to be sitting at the table, poring over your health records, your private information. And as we saw with the thought experiment, already in Alberta, your social services data, your health data is sitting in the hands of the same police force that's under investigation, right? So we have a number of police forces across this country that can barely maintain their responsibility to the electorate, and now they're be giving more opportunity to violate our human rights. Those are just a few of the changes that have happened in Ontario, and I encourage you in your local jurisdictions of your provinces to see what's happening. I'm going to be doing a talk in BC in the coming weekend, and I'll be looking at BC's legislation as well. So I point that out to kind of extend what Nishan has pointed out to, and Ciann, that when we re-language these things, when we repackage, when that kind of thing is happening in the public, what we also have happening is disinformation, because we have people that are not coming forward and speaking the truth about what interoperability means. It means that it's as easy to hand your information over to a private or public entity. It's easy for a private third-party vendor who gives you an app, and like most, there's that fine print that says, oh, by the way, by using this, you gave us all your rights to your information and to invade your privacy. So I wanted to continue. You pointed out something, Nishan. I wanted to ask you, Ciann, given that you do a lot of community-based research and your work is designed to support people and communities in getting the kinds of results they need to have a better life, what do you think it means to not have a regulatory framework that's focused on making sure that taxpayers and citizens and residents are the ones who are prioritized, who pay the bills? Because as we've seen, corporations pay less and less of their fair share. Ciann?
Yeah, I mean, it completely opens up the, sort of the door for a lot of, basically misuse of our data. We don't know what happens to that data once it is by a private entity, right? And that's essentially what's happened. I mean, Ford made no, he didn't really mince words when he said Ontario is open for business, and this is what that looks like. This is the rollout of exactly what he said he was going to do in terms of partnering with private entities, and this is the fallout of that, and that's the outcome of that. I also wanted to sort of highlight again this piece that you mentioned, that you can't talk solely about ethics, which is I think where a lot of the conversation tends to lean to, if you don't have policies and laws in place. And I really want to reiterate that point. Even in an institution like my own, which is a university institution, when I think about what ethics serve to do in the university institution, ultimately it serves to protect the institution from legal liability. It serves to protect me as a university employee from legal liability. And so that's really what ethics are intended to do when you actually put them within an institution, or when they're framed within any of these sort of mainstream institutions. And that's essentially what would actually become of an ethics, and ask for ethics, at the governmental level as well. It would be about essentially protecting the government in terms of being able to laud and collect data and do what they will with our research, with the data that they've gathered. And so really thinking about that in terms of how does ethics actually operate, we can't solely talk about ethics in absence of talking about laws and policies, and the fact that we're currently having policies that are slowly being peeled back, that are slowly being revised, that are essentially taking away our rights and our freedoms and our autonomy, essentially, and self-determination. And so really thinking about what is actually taking place in the province and across the country in the current moment, and how that rubs up against. So I do want to really reiterate that, and actually look at how ethics have actually been rolled out in institutions such as university or healthcare institutions, which ultimately they serve to protect the institution, not the people whose data we're gathering, right? And so I really want to sort of reiterate that and really shed light on how that actually ends up working in existing institutions, and how that will likely work, once this is gotten a hold of. And it goes back to the point that we can't solely, as communities, be arguing solely for ethics or the governance of data that we actually don't control, and in a climate in which we don't have rights to control or protect or reserve our data. So again, sort of highlighting those nodes that you were hitting on, Lana. And then to come back to your question about, as a community-based researcher, what do I think needs to be done in the current moment around these issues? I do think that we need to resort back to guerrilla tactics. And I've said this before, and I'll say it again, the guerrilla tactics of Black feminists, in the sense that we don't give the machine what it desires, which is data, that we find other ways to gather information. And this doesn't mean the absence of data, as you said before, Lana, that data justice doesn't mean the absence of data. It means gathering data in ways that serve our communities and not the system. And so we've got to think really cleverly about that. And I'm sure we'll have a more fruitful and discussion about what that can look like.
Thank you, Ciann. I appreciate that take. And I'm going to kind of tie that in because when I talked about interoperability, I'm sure the clinicians out there and the administrators and folks that are in the clinical environment are like, oh, but we want the data to talk to each other so that we don't have to, scramble around for it. And I want to differentiate between what it means to have interoperability that is designed by a province who's open for business and is selling everything but the kitchen sink, compared to a negotiated process that's tied to our human rights code, that's tied to the Constitution, that's tied to ensuring that we have an electoral constitutional democracy, one where we elect our officials and that our electoral system isn't undermined. And I keep bringing this point home. So for those of you who haven't seen the movie, I encourage you to see it. It's called Hacked. It's sitting there right on Netflix. The movie's called Hacked. And I'm recommending viewing that movie because what they do is they outline exactly what gets done with an algorithm. It took between 5 and 10,000 data points to undermine and shift the 2016 election of the United States of America. Canada has been put on notice for over 3 years to be careful. And part of that being careful is making sure that our single payer healthcare system data, which has data on us from conception to death, doesn't end up in the hands of private institutions and public firms, especially when NGOs are being used to mask it. And we have a number of those functioning in Ontario, in Alberta, in Quebec. It's the model that's being used to open up what should be kept protected by law and regulation. And so it's important to understand that when you allow a health file to be handled by any interest without any negotiation by the electorate, we set ourselves up for the crumbling of democracy. And we've seen it in the US and we're seeing it happen here. And so I want to tie this in when it comes to patient information. Patients are people. And I think it's important to understand that the difference between a patient and a person is a billing number. So you become a patient when you get a billing number. And the history of electronic medical records is this. It was always an accounting device. You can go and research it anywhere. Electronic medical records were designed to count and manage money. They then tried to add functionality to that. And so we've come into the 21st century version of that, which is the electronic health record that I just defined yesterday, which has the ability to be more dynamic and talk to other systems and communicate, whereas an electronic medical record, for simplicity, is a flatter, less dynamic. And so often we're sold interoperability, make sure everything can move around, but that's the job of your physician and your clinician, to broker a relationship with you, to develop that, to gain your trust and your consent. Doctors should actually be turning the screen, and clinicians, nurse practitioners, whatnot, should be turning the screen and saying, this is what I wrote into your medical file. Are you okay with that? Do I have your consent to press saved? I've had this issue with my own physician. I've had that issue with other people saying, I don't know what the doctor's putting in there. I went to another appointment and I saw those notes and I was so sad, embarrassed by the way they described me and what was shared. And so it's important to understand that you can't do with technology what you haven't gotten the consent for in person. And that's part of what we're finding with this data thing is hospitals and clinics are using our data to develop algorithms, develop commercialized assets, which are only theirs, and not telling us. So Nishan, as somebody who is ushering in the new age of public health, who is taking us away from this draconian public health that so many people are trained in and attached to, and what I want to say, I really admire the courage of your organization and the depth of work that you do. What are your thoughts around the failure of consent to be centralized in this entire process, whether it's EMR, EHRs, unconsented use of administrative data?
Yeah, and I think that as someone who is kind of in emerging kind of generation of Black public health researchers and learners, I think we've come to learn the stakes in a really kind of stark way. And there is one example that I kind of wanted to draw on that really showed what that looks like for Black people. So there was a study done in the States by Obermeyer. And basically what they did is they were looking at this and investigating this algorithm. And this algorithm basically looked, it made decisions about who got basically access into a high risk treatment program based on how sick they were. So if you're really sick and you need a certain level of treatment, the algorithm was supposed to flag you and say you get access to this particular program. And that particular program would give you much more personalized and wraparound tied-in supports. So the way that the algorithm actually decided who was going to get access into this program was based on how much treatment costs they were incurring. So the idea was, if you're sicker, you're definitely having higher treatment costs. The problem is that basically the way that the data already has baked into it all this inequality. What does it actually mean when Black people are actually underprescribed, get denied access to treatment and the like, right? So because of that, the data was suggesting these conclusions that actually weren't bearing out in reality. And this is kind of a concept that Cathy and Neil talked about yesterday, the idea of ground truth. And so I'm kind of bringing it back to some really clear examples of, for example, like imagine like you're getting denied cancer treatment, right? Even though you actually are quite sick. It's not really allowing us to point to the big gaps in how people should actually be receiving treatment. And when that's happening, those are the stakes, right? People can actually die, and that has life-threatening implications. And I'm bringing it back to that because when we're choosing to share our data with clinicians, with our family doctor, how are we supposed to know what the actual implications of those are? How are we supposed to actually have informed consent there, even from a clinician standpoint, right? Like we need to be really thinking through even as clinicians, as researchers, what the implications of collecting our clients and our and people that we're working with who are getting care from us, their data, right? So I think and I think that's kind of a really comes from a really flattened understanding of the clinician having the power to basically extract consent from their patients, right? They're not really bringing us into that. And it actually makes me think quite a bit about how, about like the long history of not seeking consent in this country and more globally in the context of health and medicine. So a researcher or scholar, an artist, Lisa Boivin, she talks about the long history of not seeking consent with Indigenous communities in Canada and the kinds of medical interventions that were done in residential schools. So these are a different set, but there are a lot of parallels to the kind of non-consented activities that happen and that continue in many ways today. And I think we need to use that and that kind of thinking to actually trouble what we mean when we're talking about consent, when we're entering into a relationship with people we're providing care for, and because, they're not really my understanding is clinicians and researchers aren't really considering what happens with the information they're collecting once they leave the treatment room, right? So how can you actually be accountable to your relationship with people receiving care if you're not actually going to know where the information is going to go? So I think that comes back to a lot of the big moves that are happening right now with the Ontario Health Data Platform, which is going to basically be a centralized way that our data in Ontario is going to be collected. That's going to replace the existing systems. And they're also planning to use machine learning and AI. We can kind of dig into it as we're going forward, but the proposals, which are being kept quite close to the chest, is they're asking for ethical use frameworks, which we've already troubled. They're saying that they're going to collect geolocation data from our mobile devices, transit, and even our credit card transaction, right? So we need to think that through and what the responsibility of healthcare institutions and researchers are to actually ensure informed consent. I'll leave it to Ciann. Did you have any questions? I know you wanted to jump in.
Yeah, I wanted to, add to that because and what I heard you talk about was sort of like, so you might just be thinking you're going to the doctor to do a checkup, and having this data then shared with your insurance company, that they're pulling data from your bank, activity, and all of this being pooled to disadvantage you when you apply for health insurance, for example, or when you're going to try to seek insurance to subsidize a cost. All of these different things are some of the ramifications. And that's certainly what Cathy O'Neill talked a lot about in terms of how these systems work. So how these algorithms and again, these are really like large words that basically we're talking about a system, right? So when you now impersonalize, the doctor-patient relationship that Lana was talking about, you now put all of this data into a pooled, centralized health system that you're talking about, Nishan, that can now be shared between the police, TTC, your health insurance, you name it. Everyone can sort of subscribe and buy into this, which is the profitability for the tech companies. But what that then means is that you've got 360 surveillance from any institution that you want to engage with and interact with. And if you think, and Cathy O'Neill highlights this, if you think the biases that are inherent in our systems don't filter into the ways in which that's right and the services that are made available to us, we're kidding ourselves, right? So again, going back to this, ask for more data and how this serves a larger nefarious system that will ultimately serve to undermine us as a people and as peoples, as individuals, as communities of people, in terms of the long-term gain here and what this actually looks like. So I wanted to just sort of elucidate some of what you're saying, and again, tying it to what Cathy was talking about, which is that we assume that these systems are not infiltrated with the same biases that humans are. But if we think about the fact that these systems are in fact built by individuals with racist bias, then there's only one conclusion as to what that actually means for us as Black peoples and Indigenous peoples and racialized folks.
Mm-hmm. And I think one thing that was I want to quickly add is like that really sometimes even takes away the question of anonymization in some ways, because if you need to get access to health insurance, then what happens when they say you're not going to get health insurance if you don't give up the data that's already collected about you, right? There's so many ways to circumvent that in the public and the private realm that feels really concerning and falls exactly as Lana's saying on Black, Indigenous, and working people.
And I wanted to jump into the conversation there around why the importance of a regulatory and legal framework. So in Ontario currently, we had very limited protections. And I say limited because they haven't really kept pace. And some privacy, algorithm, AI experts, and those who look at the ethics of these sectors, have posited the question, is it possible for law to keep up with technology? And the answer is yes. But do all players, government and private alike, want that to be kept in lockstep? The answer is clearly no. So is it possible for law to keep up with technology? Of course it is. We make the choices about what's legal in our countries, right? We saw that with cannabis. Cannabis was not legal and then it was legal, right? And so we make a decision about laws by having a democracy in which we vote, in which we consult, in which we discuss. And so we know that we can have laws that keep pace with technology, but we also know that some players don't want them to. And so we have to ask the question, where is our strong regulatory and legal framework? Right now, as it's been described by AI and machine learning experts, this is the Wild West. Some companies have come to Canada simply because we basically have no rules. And so we have to ask ourselves, well, what are the rules that are missing? We are not to the standard of GDPR, and I want to be clear, I'm not putting the GDPR, which is a good data practice regulation. That practice regulation in the EU does something specific. It allows for data to move freely and to traffic amongst, and it has some good protections. But the versions that were prior to the one that was settled on before it was watered down by big business are the versions I'm interested in for Ontario and for Canada. So at the federal level, we're wanting. At the provincial level across the country, we're wanting. And so we have to ask ourselves, why is it that both our MPs and our provincial governments have sat on their hands and not put into place protections and regulations that would stop these kinds of uses? And I like your language there, Ciann, and nefarious is the only way you can describe this at times. We already had an incident in Ontario just over the last 2 years, prior to this administration. Dr. Hoskins actually had to put his foot down and prevent the relationship between TELUS Health, who was using the prescription pad of doctors to push their preferred pharmaceuticals. And we already see that TELUS Health has become a major player in the EMR and health records, and we see them releasing and participating in that very curious project in the province of Alberta. where they're mixing records and taking data and without any laws actually or regulations holding them back. We also saw this behavior in the opioid crisis. And I liken what's going on with the failure to have regulations and laws with the ways in which the companies and the pharmaceuticals that were involved with the opioid crisis taking up so much space, being so present, providing so many incentives, providing disinformation. You don't need to worry about these opioids. They don't create addiction. Meanwhile, buried in the research studies that they didn't fund was the truth. And we're here in COVID conversations pointing out to you that there's some truths that are hiding in the details that are not unlike the opioid crisis. There is damage being done in this moment. We have a comment here, and it says, systems collect the data of equity-seeking groups under the guise of generating, yes, guise is a good word, of generating an evidence base upon which decision makers can improve policies, services, and outcomes. The other part of that comment says, this imposes massive risk on equity-seeking groups and places the onus on us for the mere benefit of getting a white status quo to, quote, believe what we are telling them. Thank you very much for that comment. And we have another one here, and it's a question. Dr. Wilson's comments, what are some of the methods, quote, guerrilla tactics we can use to gather data that serves communities? And so I'm going to let you jump in with that answer, Ciann, around what are some of the tactics?
Great questions and really great comments. Thanks, folks. So in my opinion, again, when I think about, for example, the Tri-Council agencies and some of our national funders that do ask us to, for example, make data public, there's certain kinds of data that they're definitely looking for, quantitative data being one of those primarily. And so some of the ways in which I've often focused my work, as sort of Lana alluded to from the very start, is really focusing on centering the narratives of the communities that I'm working with. So qualitative data, for example, I work with arts and digital media research as well. These different approaches and methodologies to gathering information that center our stories, center our experiences as diverse people, while not jeopardizing or putting at risk the fact that that data can somehow be misappropriated or taken up in a different way or misused to create misinformation campaigns. So a great example of that is one of the projects that I work on is the Proclaiming Our Roots project with Indigenous Black communities across Canada. And so what that project is really focused on is creating personal narratives of experience and videos that sort of capture Indigenous Black people's experiences in Canada and their histories and their realities. That kind of data is not something that can be repurposed or repackaged, but nonetheless, it's data that really accounts for what has the history been of Indigenous Black people in Canada, and it really centers the voices of communities. Other ways that we can gather information and data, whether we choose to do surveys, whether we choose to use quantitative data or not, is to, instead of gathering data, let's say through computer systems or through using servers and software, is to maybe go back to pen and paper, good old pen and paper surveys, right? And sort of really finding ways to basically slow down and possibly seize the uptake of our data, the ready and willing uptake of our data and misuse and appropriation of our data in different spaces. So these are the ways that you can do that. Again, there are certain kinds of data that these systems have more of an affinity for versus others. They're not necessarily interested in our narratives and testimonies, but that information is super important for us as communities to have documented. And so those are some of the ways that I've certainly worked around the system to, again, center community voices and to add evidence. The other piece of this is, of course, that I'm always about critiquing and questioning whether or not we need more evidence. Do we need more data on everything? Are there some questions that we actually know pretty damn well what the results are all about and what the results are going to show? And I ask us and I dare us to think through that and to think about that really, really carefully, because some things we do have evidence of. The question is, of course, what does it take for the white structures that we are speaking back to often to actually take that evidence and to take that knowledge that's already in existence as fact? When are our testimonies enough is often what I actually ask before I engage and jump into yet another project or to gather more data. I think those are really important questions for us to interrogate. And then when we are gathering data is to choose really selectively the methods that we are engaging with and what's going to be of purpose to our communities and of benefit to our communities versus what's going to serve and feed a system.
Mm-hmm. And I think I want to add that because I think there's something really useful about talking from our roles if we're evaluators, researchers, working in public health as a field. The idea of using more like quote unquote like Luddite kind of methods, you know, has been talked about. And I think also the two big things that I took away from parts 1 and 2 as well were actually, what if we're flipping and doing a counter kind of mapping of the kind of methods that they used on us, right? When you see the COVID hotspots all across the city of this is where the Black and sick people are, you know, those are kind of coming from a particular kind of deficit framing of us, right? And that kind of carries on. We have to collect this race-based data because we have to convince people that we are the worst off and and that's kind of how, in that kind of framing, we assume that will lead to accountability. We assume it'll lead to quote unquote racial justice, right? When in fact, why aren't we focusing on actually doing a counter mapping of where are the locations of power? Where are the workplace violations that put people in a higher risk of getting COVID in the first place? You know, like those are kind of coming back to what Ruha Benjamin was talking about in her talk in the first week, in the first panel, about actually studying the processes of racism that bring us here instead. You know, and I think another piece that Dr. Adil Abdullahi was talking about was questioning the kinds of knowledge hierarchies, which I think Ciann was speaking to, about what is good and reliable data, you know, and not actually letting the state to collect or hold our data. So I think those are kind of questions that we can grapple with, thinking about like what kind of legacies are we inheriting as coming, you know, having graduated from my public health degree only 2 years ago. And I think the other piece is actually like, well, what about the collective and the communities as a whole more broadly that aren't in upholding these spaces, you know, and from our space, like the collective also focuses on supporting informed refusal. So we talked about informed consent, but also how to do informed refusal in responsible kind of ways. So from us, one of our core values is actually focused on critical consciousness raising, and you know, doing the work within our sphere of influence. So we've hosted various discussion groups about these exact topics, and also released a public letter about that as well. So I think that focusing also on public education as guerrilla tactics is helpful.
Ciann, did you want to add anything before we move into the closing minutes of the session?
No, I think that the point, I think we both sort of answered in different ways. There's some of the different tactics that can be used, but I think the one thing that I will add is that we've got to think cleverly about how to find ways to still serve our communities as leaders. So whether that's public health leaders, whether that's research leaders, folks who are business professionals, we've got to find ways to serve our communities and not the system. And I do sort of challenge us as Black folks to think really cleverly about the ways in which we can, you know, serve in our own positions, wherever they may be, universities, health systems, business, you know, professionals, to really think really cleverly about the ways that we can serve our communities and actually, you know, not feed a system. And I want us to really decipher, you know, the ways that we can do that. And so we've talked really pointedly about research data today because we're both, you know, involved in health research in some capacity, Nishan and I. But I think that it's incumbent on all of us, irrespective of where we're situated in the different industries and institutions that be, to find really clever ways to, again, you know, serve our communities and not undermine our communities. And so that really, to me, is what it's got to go back to. It's got to go back to Black feminist politics. That has always been what has been the backbone of allowing our communities to survive. And so I do want us to think really cleverly about that.
And in the closing moments, I just wanted to highlight a few points in terms of, you know, what next? What can you do? I think some other practical things that, you know, for some of us, we don't work in the academy, we don't work in business in the kind of ways that we get to make decisions, and rather some of us are having decisions made for us. And so when you go into your doctor's office, you should be asking, and write it down. Feel free to share that information with us. So what EMR, EHR system are you using? What is that third-party agreement? Do they also have access and ownership to my data in part or in some, right? And also to say, you know what? Let's actually make an appointment to talk about my health data record because I want to know what's happening with it. We have found out again and again through investigative reporting, and we know that investigative reporting is shrinking because the business of news is being shrunk. And so we know that if we're not asking the questions, ask your doctor, ask your clinical practice, ask your CHC, and ask your hospital. Do you do administrative data things, and what are you doing? Because until we push back and make sure that our tax dollars and our time is being valued, we can't trust that the system's going to do it for us. And as we head out, I want to point out that the relationship between Jack Poulson's work and looking at the relationship between tech companies and the military, we started with that on Wednesday to point out that there is a deep and long history between technology and the genocide and violence and elimination of Black and Indigenous people, not just in the Americas, but around the world. And medicine has been central to that. The Nuremberg Code comes because of the violence that physicians have done, not just there, but remember, on those trials, physicians in the Nuremberg trials cited the work of the United States of America in anti-Black segregation and inhumane research. And those same researchers in the US and scientists and physicians were tied to long-standing medical schools here in Canada. So let's be clear. This is not a benevolent environment where every physician means you well, and I'm not by any means suggesting that any physician means you harm, not by any means. And I can say this, and I say it, kind of cheekily, but quite honestly, many of my best friends are physicians. So what we want to point out here is we have all over the world governments pushing hard to the right, where we're having anti-immigration sentiment, where people are being killed in cold-blooded murder by people in uniforms. In supposed democracies, we're having people snatched off streets. And so we are in an environment where totalitarianism is but one election away. We are watching our current administration in Ontario and across the country change the rules of law while they think no one's looking. And so right now we're going to come to an end and wrap this up. And I want you to remember, this isn't just about health. Your healthcare records will soon be used to decide, and they already are being used to decide what your interest rate for your loan is, whether you're eligible to rent an apartment, whether or not you can have a certain job. Just a few weeks ago, we almost lost. It was one vote that kept us, when I say us as everyday people, Black, white, and everybody in between, from having to produce our human genomic record to an employer. One vote. It was 5-4. And if you don't think they're coming back to tear that down, everybody better get ready. Because there's more than one way to have a number tattooed on your arm, and that is to have somebody walking around with your genomic code and telling you when and where and what's going to happen next. So we are in an age of wonderful technologies. These are the same technologies that can take us forward collectively and help us renegotiate the last 400 years. But that only happens when we come to the table ready to negotiate and demand that we maintain a democracy, that we can move our way back to honoring the treaties in their fulsomeness. In our current configuration, we're being led down a garden path and being told disinformation that race-based data is going to do things that it hasn't done in 400 years. They had the data on H1N1, they did nothing. We knew where people were dying and they did nothing. We know where they're dying now. We had the army come in and they did nothing. So if you think a bunch of numbers on a paper are going to do something, that's a delusion. And I encourage you to shake your head and join us in getting something done. We're now going to cut away as we wrap up, and we have a couple of brief announcements, and I'm going to cut away to Denise Baldwin, who will bring this series to a close. And Denise Baldwin is a Black Anishinaabe citizen from the Chippewa of Nawash First Nation, located within the beautiful Bruce Peninsula. She is of the Turtle Clan. She has over 20 years of experience working on the front lines in prevention, supervision, mentorship, and community service for vulnerable populations, specifically Indigenous people affected by the war on drugs. Denise is dedicated to community building and providing services to diverse communities, both socioeconomically and culturally. Denise is currently developing the Indigenous Harm Reduction Network that will be the leader in Indigenous harm reduction philosophy and practices. To learn more about Black Indigenous peoples on Turtle Island, please go to Proclaiming Our Roots. And now, Denise Baldwin, please close this for us.
Bonjour. Gijagate Dijnakas, Washika Dodem. Shumigwech to Ready for Black Lives, and to LLana for inviting me to close these last two COVID conversations. I'd like to say miigwech for this space and for this opportunity. And if I could just say one thing on these conversations that we've had, is that I feel that it is so important to have control and to have access over our own stories, our own truths, and our own beings as Black and Indigenous people of Turtle Island and the diaspora. We need to protect everyone, every one of us. The status quo expects us not to know, but that's not today, though. That's not right now. I hope we can provide this information to each and every one of our community members, regardless of where they're at, location or in life or otherwise. Data is dollars. White supremacy has always made money off of our lives. Let us keep vigilant. Please let us keep our communities informed and carry these meaningful conversations forward. Gjem Nado, we give thanks for your energy. We give thanks to Shkakamekwe, our mother, for all the life that she provides. We are grateful for our community members that have invested in us and that are here doing the work to protect us. I pray that we move forward in a way that reflects our truth and creates spaces that reflect our inherent rights. To our ancestors that fought for us to be here, we love you. For our loved ones that we have lost this year, we give thanks for your life. Miigwech for your spirits, each and every one of you. Please be safe. Keep your family safe. Keep our community safe. Keep our stories safe. And keep our data safe. Miigwech.
Thank you, Denise. I appreciate that. I really do. And as we say farewell to you, myself, Ciann, and Nishan, we also want to provide a few brief announcements. One is that the Black Public Health Collective will be announcing and releasing its strategic plan, and you will see that on Twitter. Is that correct, Nishan?
Yes.
So, on the website. Wonderful. So please keep an eye out for that. If you want to know what the next generation of public health looks like, it's the Black Public Health Collective. I haven't seen it better anywhere else, and we've gotten lots of wonderful comments from the platform because of the work of Black Public Health Collective. So thank you very much. Also, I'd like to say thank you to my colleague and partner in all of this, Dr. Ciann Wilson, who does a lot of work out in the Kitchener-Waterloo area and worked to create a March 20,000 strong in support of Black and Indigenous lives, not but so many weeks ago. And I'd also like to point out that at Ready for Black Lives research, ethics, data, and evaluation, what we aim to do is make sure that you're informed about what's going on in the world around you so that you can co-create it. It's a democracy, let's use it. And we are going to be rolling out the second phase of our national project, which has taken place over 3 years. And so the second phase of this is we're moving into our community conversations around AI and data for Black populations. We also will be supporting other communities that might need that because this is a complex area, but we've done our homework and we've been at it for a minute. I've been at this work for much more than 3 years, and I'm glad to share my knowledge and learnings. We've also partnered with Ida B. Wells Just Data Lab of Ruha Benjamin at Princeton University, and we're developing a wonderful COVID testing and treatment kit that will allow people to have informed consent and informed refusal. And if you don't know where your data is going, everyone, hang on to it. You don't have to provide your data markers to anyone. That's private, it's personal, and until they can show you a law or regulation, you are not protected. Our human rights every day are being flushed down the tube as we move into interoperabilities, into health data platforms that are not in conversation with communities like ours and with knowledgeable people. So we thank you for your time. We look forward to you joining us again. Please make sure you signed up for the mailing list, because when we announced the second phase where we will be holding conversations through breakout rooms to finish up the health data strategy that we began developing through the data protocol for Ready for Black Lives, and rolling out each of the instruments, the databases, so that you can find information and figure out and learn how to do this safely. So just like there's street proofing, there's safer sex, there's also safer data use. And we're here, we got you, and we look forward to seeing you next time. Bye for now.